I'm the director of the International Diabetes Institute here in Melbourne. We're probably the largest facility for diabetes research and care in Australia and have international status as a leading centre on all aspects of diabetes. Well, some 20 years ago, diabetes, certainly in this country, was considered a Cinderella disease of very little significance. Over the last 20 years, there's been a 300% increase in the number of people with diabetes. Our institute undertakes the national study of the burden of diabetes in Australia, and there are now over 1 million people in Australia with diabetes. So it's one of our major health problems in this nation. Well, diabetes is really very much on the roll as an international health problem. This institute undertakes the predictions of the future burden of diabetes globally for the International Diabetes Federation, and we've predicted that there's something like 230 million people now with diabetes, and by the year 2025 that burden will be over 350 million. So it's very much an escalating problem and of great concern, and a great need now for measures for better treatment and prevention. Well, there are two forms of diabetes. Type 1 diabetes, where the pancreas, the cells in the pancreas that make insulin are destroyed, and people need insulin to stay alive, and up to 4 injections of insulin a day. And then there is the other form, which is commoner. 90% of cases worldwide is type 2 diabetes, which usually is related to our sedentary lifestyle and can usually be treated by weight reduction and exercise and a proper diet, often needs tablets and sometimes needs insulin. Well, I'm amazed how well people cope with type 1 diabetes, but it involves up to 4 insulin injections a day and finger pricking to test the blood sugar up to 4 times a day. So it actually involves a very strict regimen of care, of diet, of exercise and medications, so that one of the major things we're looking for are better ways to treat type 1 diabetes and to make the life easier for people with type 1 diabetes. Over the last perhaps 10 to 15 years, there have been very major breakthroughs in terms of better injectable insulins. But the holy grail of type 1 diabetes treatment remains the possibility of an oral form of insulin. There's been huge investments around the world in this area with very little success to date. In terms of the future management of type 1 diabetes, clearly something like oral insulin would make life very much easier. And there have been a lot of initiatives to try and develop a good formulation. More recently, there have been insulin that can be inhaled and gets into the body through the lung, but we believe that an oral form of insulin is more likely to be acceptable to people in the longer term and make their life much easier. Well, if I had type 1 diabetes, I may be having something like 13 to 1500 injections annually. Can you imagine if one was able to take the insulin by mouth and avoid those injections, how happy someone with type 1 diabetes would be? Well, Apollo came to see me some 6 months ago to discuss results that they had with an oral insulin that was actually working in a laboratory setting. And I was amazed with the data. In fact, so amazed that I felt that I had to discuss it with several of my colleagues because it was almost too good to be true. And indeed, they were equally enthusiastic, and we decided as an institute team that we'd like to work with Apollo to see whether that particular oral insulin could be taken into human trials. We're actually working with Apollo at the moment to advise them on how they will undertake human trials, We hope to be working with our own patients here at the International Diabetes Institute. I think they're going to be very excited at the prospect to be party to such a trial. We're at a very early stage in terms of the potential to develop an oral insulin formulation with Apollo. However, to my mind, the data I've seen so far makes this one of the most forward-looking and best prospects, actually, of an oral insulin, certainly in terms of what I've seen today and in terms of what I know is available or being worked on in other parts of the world. One has to realize that you can't give insulin orally because it's a protein that actually gets broken down by the acids in the stomach. And one has to develop a trick to trick the stomach to make sure that the insulin isn't denatured or broken down. And Apollo seemed to have developed a technology that gets quite a significant amount of insulin through the stomach into the bloodstream. And people have had a lot of difficulty in actually developing this technology elsewhere, and that puts Apollo actually at the forefront, to my mind, of what's going on. People have had very limited success around the world in being able to take an oral formulation of insulin. What Apollo appears to have is quite a unique technology of a carrier system that can get insulin out of the stomach area into the bloodstream and still be active. And that is quite an exceptional achievement. Well, as a leading international diabetes research centre, we have many approaches by companies to participate in clinical trials and help them with new products. We're very excited about the Apollo oral formulation of insulin, and it's quite clear that at this point in time they have the jump on the rest of the competition, and we're very excited about being party to the clinical trials that should start soon.